So in our Today in Politics segments, 3 million South Africans lost their jobs during the lockdown. Now, of this number, 2 million are said to be women, and the majority from poor socio-economic backgrounds. This is according to the National Income Dynamics Coronavirus Rapid Mobile Survey, which also found that 33% of South Africans who earned an income were not paid in April, while 47% ran out of money to buy food. The survey is the largest survey of South African households conducted by 30 social science researchers from 5 South African universities. To speak to the politics of hunger and job security and many other related issues, I'm now joined by the principal investigator, that's Nic Spaull. Nic, thanks very much for your time. Welcome to the AM Report. Perhaps let's start by taking a step back and just reflecting on why it's important to conduct this type of study.
Sure, and thanks for having me. The reason why we conducted this study was that we knew there were going to be a lot of job losses, but we didn't know how many job losses there would be and who would be losing their jobs. We now know that answer because the results have been released. And as you say, the brunt of the job losses have been borne by women and the poor.
Yeah, it's interesting to note that. Do we know why?
So it's not entirely clear why. I think that the leading explanation at the moment is that the lockdown affects people differently. Some people can work from home, some people couldn't. Some people had very precarious jobs that would be lost in the lockdown, whereas other people had more stable and permanent jobs. But I think that the gender finding is one that's particularly relevant. Because just about a week ago, SASSA reported to NEDLAC that 2/3 of the COVID-19 grant payments were actually paid to men, but our study is showing that 2/3 of the job losses were actually women. So the grants that are meant to be covering the unemployed are actually going predominantly to men, even though most of the job losses are actually women.
That's incredibly interesting. It does, at least on the face of it, call for a change in policy. In what ways can there be a policy, centered response to what appears to be, a misallocation of relief?
Definitely. And I think this is something that points to the reason why we need these sorts of studies, because it guides government independently to say, are your relief efforts being targeted to those who are most in need? You mentioned earlier that some of the job losses were disproportionately affected. To give you some of those stats, for people that earn more than 24,000 Rand a month, only 5% of them lost their jobs, compared to people that earn less than 3,000 Rand a month, 38% of them lost their jobs, and a further 16% lost their incomes. So in other words, of the people that are earning less than 3,000 Rand a month, half of them lost all of their income between February and April.
Again, driving home the concept of the poor getting poorer, whilst the rich, get slightly poorer, but certainly at least comparatively get richer.
Yeah, definitely. And I think as your earlier study showed, how this impacts on things like food security and hunger are also really important. So although 47% of households reported that they ran out of money to buy food in the month of April, 1 in 5 said that someone went hungry in the last 7 days. This is much, much higher than anything we've seen before in previous surveys in South Africa. We even see child hunger significantly rising, with 1 in 7 households reporting that a child went hungry in the last 7 days.
Yeah, and that's where I was going, especially because there's this raging debate about whether or not schools should be reopened. And I know a big part of that argument has to do with the nutrition program, where most children get the only meal they receive during the day at school. Is there, a connection between how parents are faring and whether or not children get the meals they need? I mean, has the research shone any light insofar as that connection, perhaps?
Definitely, I mean, that's one of the encouraging findings from this survey, is it's showing that parents are shielding children. So even in households which are experiencing some hunger, half of households manage to shield the children from that hunger. So adults are reporting hunger, but children are reported not to be going hungry. But the worrying finding is that if adults are reporting hunger every day or almost every day, they are much less able to shield their children. So then we see child hunger also rising. So although parents are managing to shield their children when they're experiencing hunger 1 or 2 days a week, if they're experiencing hunger every day, they no longer are able to shield their children from that hunger. And just one other thing on the National School Nutrition Program, 9 million children get a free school meal every day when schools are open. And if you think we have about 50 million people in South Africa, that's 1 in 5, and all of them are children. Those meals are not happening now that only 2 million children are back at school. But the gender findings are also linked to school closures. When schools are closed, the caregivers of children, which are predominantly women, cannot go back to work. Opening the economy without reopening schools is one of the big problems of the reopening of schools while the closure of schools while we haven't reopened the economy. And I don't think that that's been taken into account.
Yeah. I remember coming across some research suggesting, for instance, that domestic work should in some ways be co-opted into the economy, right? And I presume that's one of the ways through which we can at least, at the very least, acknowledge work being done predominantly by women and at least allow for it to be, quote-unquote, remunerated in some way. And surely this will have a bearing on the kind of statistics we're talking about this morning.
Most definitely. I think we actually have a paper on that by Professor Daniela Casala and Dori Posel from Wits University, where they write about the paid and unpaid economies and the role of women in those economies. Because we did also ask about childcare, and women report significantly higher rates of working an additional 4 hours per day on childcare during the lockdown, which is a higher rate than that for men. There are also higher rates for men, but not as high as for women. And I think that those findings are not independent of the job loss findings that we're seeing. If you've got children to care for at home, it limits your ability to work either from home or to go to work when you have young children at home. So I think that's another finding we have to take into account when we're thinking about school closures.
Absolutely. Nic, is there any silver lining from the study? I'm desperate for some good news. Or at least, perhaps I should ask, are we seeing signs that suggest that perhaps some good news is on the horizon?
So I think one of the good news stories here is that this was the first wave. So this was reflecting the job losses at the peak of lockdown in the month of April. But this is only the first wave of the study, and there will be 5 further waves. So in 6 weeks' time, we'll know what the second wave results are, and those should be able to point to the impact of things like the COVID relief grant, as well as the top-ups to the government grants. So in a way, a lot of these findings can be considered a baseline, but because we have the study, we're going to be able to measure what is the impact on household welfare and the labor market of government's initiatives. And I think all of us are hoping that as these are scaled up and really reach the poor, that we're going to see a decline in some of these rates of hunger and desperation.
Nic Spaull, always great having you on. Thanks very much for your time indeed. Nic is an economics researcher with the Stellenbosch University. Thanks very much indeed for your time.